Hello and welcome to the UT Health San Antonio Virtual Town Hall. Our topic today is a COVID-19 vaccine update. My name is Michelle Mata and I will be your host for today's town hall. We know that the topic of COVID-19 is of utmost importance to the UT Health San Antonio community, and we appreciate you viewing this town hall. Our esteemed presenters include Dr. William Henrich, President of UT Health San Antonio, Dr. Cindy Sickora, Vice Dean of Practice and Engagement in the School of Nursing, Dr. Michael Charlton, Assistant Vice President for Risk Management and Safety in the Environmental Health and Safety Department, Dr. Tom Patterson, Chief of the Division of Infectious Diseases and Professor of Medicine, and Dr. Jason Bowling, Associate Professor in the Department of Medicine and Division of Infectious Diseases.
Thanks, Michelle, and welcome everybody to our town hall this morning. If you're like me, 9 months of this COVID pandemic has been enough, and we are finally seeing a light at the end of this dark tunnel with the now imminent arrival of a COVID-19 vaccine in this next week. And I don't know if you're like me and this is where you are in your place in life, but it feels good, at least it feels good to me, that we are fighting back, that we're finally fighting back with something very intentional that will put us on a path to eradicating the COVID pandemic so that life can resume to a normal status. This is so welcome, and I have to say it's inspiring and gives us wind beneath our wings to do this. I'm very happy to see this step being taken. Now, there are many questions about what's known and what's unknown about this vaccine. And in this town hall today, several experts will take us through all the steps and all the work that's been done to get this campus ready. Because our essential role as health providers means that we have to stay healthy. We have to stay in the front lines in order to take care of the population we're privileged to serve. So what we're going to do today is talk about the vaccine's development, what's behind it, who's first in line to receive it, how will the process of administering it take place, where can you be tested, whom should you call if you have questions. Each of these questions will be expanded in detail and explained in this next session. If I could have the next slide, please, Michelle, I'd like to highlight the committee that's been working on this so diligently. This COVID-19 task force was charged weeks and weeks ago, and they've been hard at work behind the scenes for these past days. I'm particularly grateful to Tom Patterson and Mike Charlton for leading as co-chairs the COVID-19 task force. I'd like you to pause for just a minute and scan down the list of these experts who've been so instrumental in forming our policy and our approach to COVID-19 on the campus. And the body of this work will be presented in the slides that follow, in the presentations that follow. Now, while we're going to attempt to answer all the major questions today, it's clear we won't get to every single question. And following this presentation, there'll be ample ways that you can continue to pose questions as you learn more about the vaccine and what's ahead of us as an entity. So without further delay, I'd like to turn our microphone over to Dr. Jason Bowling, who's going to give more specific information about the vaccine. He, in turn, will introduce Drs. Patterson and Charlton, and then Dr. Sickora will speak, and then I'll wrap up at the end of the meeting after we've had a few frequently asked questions posed and answered. So, Dr. Jason Bowling, please take over and make your presentation. Thank you.
Thank you, Dr. Henrich. As Dr. Henrich mentioned, this is an extremely exciting time for UT Health San Antonio and our community in our battle against COVID-19. Before I talk about the tiering schema that we've used, I do want everyone to please rest assured that the goal of our task force and UT Health San Antonio is to make sure that we provide the vaccine as quickly and as safely to everyone as we can. However, we are initially going to be limited by the amount of supply that we have. And so based on that, we've had to prioritize who receives the vaccine. And so to that end, we have used the Advisory Committee on Immunization Practices, ACIP, which is a subgroup of CDC, their national recommendations and guidance. And here you can see their proposed interim phase 1 sequence. And really this should probably be listed as tiers, is how we've looked at it. And so if you see in tier 1A, the initial group to receive the vaccine, recommended to receive the vaccine, are healthcare personnel and long-term care facility residents. This really dovetails with our local task force driving factors, which have been getting vaccine to providers so that it can continue to provide care for our COVID positive patients, those that have the highest risk of exposure, looking at mitigating factors, as well as the most vulnerable. So our phase 1A is our healthcare personnel and our long-term care facility residents. Phase 1B is our essential workers, those workers that we rely on so that we can continue day-to-day business. And you can see some examples listed here: the education sector, food and agriculture, utilities, our first responders, our police, our firefighters, our corrections officers, and transportation. Followed by the tier 1C or phase 1C, are adults with high-risk medical conditions that are extremely vulnerable for complications from COVID-19 infection, as well as our adults that are 65 years of age and older, as we know they're at higher risk for hospitalizations and mortality. So using that ACIP guidance, our vaccine task force has looked at how do we tailor that to our local community. And so here you can see our tiers for UT Health San Antonio, so that you can get a sense of where you are. There's more information to come through emails and communications. But what we're looked at is our tier 1A is largely our healthcare personnel and our healthcare workers. So to provide some context for this, we're anticipating that the initial shipment will be 5,850 doses of the Pfizer vaccine, and we're going to talk more about the details of this. So as you can see, our tier 1A are our healthcare workers. Our number is 5,100. So the good news is that our initial shipment will really cover our tier 1A and get well into our tier 1B. So when we talk about the healthcare workers, we're talking about the whole team of people that's required to take care of patients. This 5,100 healthcare workers includes the 1,300 people that work with COVID positive patients each day. So within tier 1A, we've actually prioritized within that tier so that our healthcare personnel that are taking care of COVID positive patients are first in line, followed by our other healthcare personnel that are taking care of the other patients. Tier 1B includes the essential workers following the ACIP recommendations. So you can see we have 900 there. Our essential workers, emergency responders, and workers who support the infrastructure. Tier 1C includes employees with multiple underlying serious health that put them at risk for complications or a severe COVID-19 disease. And then our tier 2 is our 4,400 remaining UT Health personnel and patients with one serious health condition. So our overall goal, again, is to get UT Health vaccinated with a safe and effective vaccine as quickly as possible. I think it's really great news that our initial shipment is as large as it is, 5,850. That's really going to help us move through these initial tiers quickly so that we can continue to provide vaccine to everybody as soon as possible. So I do also want to point out that there are a host of COVID-19 vaccine candidates, which is really great for everybody in the entire world battling this pandemic. The initial vaccine candidates that we're going to focus on are the ones that are coming out soon, which are the Pfizer and Moderna vaccine candidates. The Pfizer vaccine is the vaccine that we're anticipating to receive next week. Both the Pfizer and Moderna vaccines use an mRNA platform. Dr. Patterson is going to talk more about that. And really fantastic news, they both appear to be highly efficacious with an efficacy rate of about 95% for both of them. They also appear very safe and well tolerated. There's rare serious concerns with the Pfizer vaccine. We have the most data on its safety profile. It received, FDA met and talked about them yesterday. And there was news that went out about that. I'm so sure you've seen. And so it's receiving EUA approval and will be distributed. The Moderna vaccine should be behind it shortly. The safety information that we have so far shows there's no serious concerns. It's still pending FDA review and approval. The following two candidates use more traditional viral vectors. The Oxford AstraZeneca uses a chimpanzee adenovirus vector to deliver a spike protein of the SARS-CoV-2 virus. It also, fortunately, looks very efficacious. Prelim data is 60 to 90%. We'll review the information on that as it gets more data on its efficacy. We're still pending safety data. We're still pending information on the following three vaccine candidates. The Johnson & Johnson uses a human adenovirus 26 virus. It's a traditional kind of viral vector delivery system. We're still waiting for efficacy and safety data on this. And then there are a couple of recombinant protein adjuvant platforms with Novavax and Sanofi. So more vaccine candidates to come. The good news is by having a host of different vaccine candidates using different platforms, we should have a lot of options. And really, this is going to be necessary for being able to really tackle this historic challenge of vaccinating the entire global population. So we want to drill down a little bit more on the specifics of the Pfizer vaccine. We are tentatively anticipating our first shipment next week. Ideally, this is going to be shipped on Monday and we will receive it on Tuesday. This will be followed by weekly additional shipments. We know that the initial shipment is 5,850 vaccine doses. We do not know yet the amount that will be received in weekly additional shipments, but more shipments will be coming. This is a 2-dose series, so it's important to recognize that you will receive 2 doses of the vaccine to receive a complete course. So there's the initial dose followed by the second vaccine dose 21 days later. The Moderna vaccine, fortunately, should be following shortly behind that. We're still waiting more details to firm up the receipt of this vaccine, but it will tentatively be available the following week, also followed by weekly additional shipments. This is also a 2-dose series with the first dose followed by second dose 28 days later. And so one of the things that's going to be important is that when people receive an initial dose of vaccine, that they have that logged so they receive the same vaccine later per the course as recommended. The Pfizer vaccine, again, is 1 dose followed by the second dose 3 weeks later. The Moderna vaccine is first dose followed by the second dose 28 days later. So looking at these vaccine timelines, there are 10 San Antonio facilities that will be receiving the Pfizer vaccine. We're on the front end of that on December 14th. The 10 facilities will be receiving the Pfizer vaccine to December 14th through December 18th. Again, both vaccines will be available to healthcare workers and long-term care facilities first, following the ACIP guidance. And really good news, long-term care facilities and their residents are going to be taken care of by a contract between the government and commercial facilities. So the government is contracted with Walgreens, CVS, large commercial pharmacies to not only supply vaccine, but also administer vaccine to our long-term care facility care workers, as well as the residents, that vulnerable population there. For general community, it's anticipated that vaccines will be available by spring of 2021. So we will have more information as we receive more shipments, but the community will also have access to vaccine soon. Then I also want to point out that UT Health San Antonio is part of the COVID vaccine prevention network. And so there will be some vaccine trial opportunities available at UT Health San Antonio soon. This could be a great opportunity for family and friends. With that, after discussion of timelines, I'm going to turn it over to Dr. Patterson to talk more about the science and specifics of the COVID vaccines. Thank you.
Thank you, Dr. Bowling. And it is my pleasure to participate in this town hall and to share a little bit of information that we have on vaccine specifics. So a question that many of you may have is, what in the world is this mRNA vaccine that's been talked about? The technology is new. It's the first time that a vaccine has been approved with this indication, but it's not unknown. It's been studied for more than a decade. Obviously, the timeline was very compressed for this vaccine development, but safety was foremost, and the traditional assessments for efficacy as well as safety were followed. They were just in a very compressed timeline. It's important to recognize that these vaccines do not contain any live virus. You couldn't get COVID from receiving this virus. The messenger RNA is delivered to cells. It's contained in a lipid bilayer, so it doesn't carry a risk of causing disease. And it's also really important to recognize that the mRNA from the vaccine doesn't get incorporated into the nucleus of the cell. It's not gene therapy. It's just a way of delivering a message to the cell to make the spike antigen that then produces the antibody response. And so that's what is really being done. The proteins then trigger the immune response, build immunity to the SARS-CoV-2, the virus that causes COVID-19. So does the vaccine really help stop the pandemic? Building immunity through the vaccination will definitely help reduce transmission from person to person. We expect SARS-CoV-2 may well remain a coronavirus similar to the seasonal flu. That is, it may occur either in certain settings, like in congregate settings moving forward, or it could even occur seasonally. That's yet to be determined. We won't know that until time tells. But we do hope the vaccination will help reduce the likelihood of severe symptoms. And the data from the first two trials clearly show that severe symptoms are much less likely to occur in those patients who get the vaccine. Now, we don't know if the vaccine eliminates the virus or really reduces those symptoms. So it will be important for immunity to develop in a large number of people, but we really hope that the vaccine will also help reduce the even spread of the virus itself. But again, those data about the virus itself are still pending. So why is getting the vaccine important? Obviously, we want to maximize benefits and minimize harms. That's really the premise of the EUA. EUA stands for Emergency Use Authorization, a term that probably all of you are familiar with now, something we didn't talk about a lot, but now we hear about a lot. But it's really the aim to allow the FDA to get the vaccine out as quickly as possible where the benefits outweigh the risk. Formal approval will happen eventually for these vaccines, but may take a substantial time, and the morbidity and mortality that occur by delaying that use would be substantial. So we definitely want to reduce the COVID-19 associated morbidity and mortality in healthcare workers. As Dr. Bowling pointed out, these are the persons at really high risk for obtaining the virus when caring for patients with COVID, and are critical in maintaining our healthcare workforce. We also need the vaccine to reduce burden on strained healthcare capacity and facilities, and then, of course, to preserve essential services from the COVID-19 response and maintenance of overall functioning of society. So clearly, the ability of healthcare workers to remain healthy helps protect the health of others and minimize social and economic disruption. So this slide shows the first two vaccines. In this town hall, we'll just focus on those. We won't really go into the details of the others until later in subsequent meetings. But it's clear that from these trials that the same rigorous safety assessments has been undertaken before approval by the FDA, with recommendations by the Vaccines and Related Biologic Products Advisory Committee, which met yesterday for the Pfizer vaccine, and by the CDC ACIP, who's responsible for recommending in whom the vaccine should be delivered. So if we look again at the Pfizer and Moderna platforms, Moderna with an M and an RNA, right? So Moderna. We know that this was given to around 44,000 persons. They were more than 12 years old, randomized 1-to-1 to placebo. The doses are lower that were eventually settled on to be given, and it was given in 2 courses. It was more than 90% effective, as I'll show in the next slide in a moment. But really, that's an incredible amount of efficacy, even in the short run. We don't really know for sure how long it'll last. Eventually, this number was even greater, but with a dramatically higher number of cases in the placebo arm as compared to the vaccine. And efficacy really started even after the first dose. We won't show you these data today. They're available online at some of our other sources we'll reference at the end. But consistent efficacy was seen across age groups, across genders, race, ethnicity, even in other high-risk groups. And the severe reactions have really been limited, although we'll talk about some of the reactogenicity. Similarly, the Moderna vaccine was a really large trial given in 2 doses with very similar efficacy, with, again, the elimination of severe cases with the use of the vaccine, which is clearly one of the goals, with very few adverse events. So this really impressive Kaplan-Meier curves shows the cumulative incidence of COVID after dose 1 in an all-efficacy population. For those of you not used to looking at this, this shows the overall incidence, that is new cases of COVID in the placebo arm, and this is the vaccine. It doesn't really take much to realize the dramatic increase in protection that's seen after that vaccination. And really interestingly, the curves begin to diverge. You see a difference after about 10 to 12 days, which is really after a single dose. So your efficacy really probably begins after a single dose, but is even greater after a second dose is obtained. So what are possible adverse events, or what can I expect, or what can you expect when you receive an injection? So if you look at local reactions, they're pretty common, right? So injection site pain occurred really frequently, especially after the second dose, and was even higher in younger people. A little bit of redness and swelling, but severe reactions, very uncommon. The median onset was between 1 day and 3 days. Most of them were before 72 hours and resolved in 24 to 48 hours. So different than the COVID, these resolved really relatively quickly and weren't associated, of course, with other COVID symptoms because it didn't really give you COVID. When you look at systemic reactions, those were pretty minor, less common in the patients greater than 55 years old, which might suggest they have a less of immune response. But again, as I said, the data didn't really support that those persons didn't respond as well in the data that was obtained. Fatigue, headache were more common. Chills, muscle pains also occurred. And fever, as I pointed out, ranged from 4 to around 16%, mostly after the second dose. Of note, in the UK, after the rollout, 2 anaphylactoid reactions occurred in 2 healthcare workers who had serious allergy reactions. These persons carried around an EpiPen for reaction with them, and the reaction wasn't anaphylaxis per se, but was an anaphylactoid reaction, so that caution is advised in that setting. So I'm going to turn now to my colleague, Dr. Mike Charlton, to go through logistics of vaccination here at UT Health San Antonio. Mike?
Thank you, Dr. Patterson, for that. Those data are very compelling and certainly a hard act to follow. Obviously, let's turn the page towards how we might fight this using some of those vaccine tools. And what the Health Science Center has done is use our task force to use the prioritization matrices that Dr. Bowling illustrated earlier and apply those to our workforce here at UT Health. Using those matrices, what we've done is come up with a schedule over the next about 10 days to tentatively vaccinate the tiers beginning December 16th and going through probably December 22nd or December 23rd. The hope with these vaccine clinics is to vaccinate about 1,000 people per day here on the main campus of UT Health. This particular vaccine is not mandatory. The hope is that it gives us this protective nature that Dr. Patterson illustrated, but it's not mandatory currently because it's still under an emergency use authorization status with FDA. But we think because of the compelling information, there will be a tremendous interest in our healthcare workforce in obtaining and going through the vaccination process. Just as part of the vaccination process, Dr. Patterson mentioned several potential side effects. It's a typical intramuscular vaccine that probably most of our audience is familiar with. It's given IM. What we will do is use an observation room staffed by our emergency medicine fellows and faculty to observe people for a 15-minute period post-vaccination, just to make sure there's no immediate adverse events. The CDC has promoted 2 tools for long-term follow-up post-vaccination. The first tool is one that probably many people are already familiar with. It's called the VAERS system. The VAERS system is one for the long-term monitoring of vaccines and the adverse events associated with them. That has been around probably my entire adult lifetime. That is a system that generally patients report their adverse events to their healthcare provider, and the healthcare provider then reports those to the state health departments and to the CDC. In this particular vaccine, because we're very interested in seeing what the data is in more of a real-time fashion, what they've developed what they call is FACP. It is a mobile phone, smartphone-based system, free of charge, that allows you to immediately report adverse events to the CDC. And there's a website there on the handouts that will allow you to download that to your mobile phone. It's very straightforward. It takes literally a handful of seconds just to download it and then go. And one of the benefits of the FACP system is it does send you a reminder for your second follow-up dose, when to receive your second follow-up dose directly on your smartphone, which is kind of a nice thing. Dr. Bowling mentioned some of the things that can happen. Obviously, this particular vaccine teaches your cells, does not introduce COVID at all. And so because it is teaching ourselves this immune response, there is a possibility, normally it's about 4 to 16%, of having a high fever, of about 100.5 degrees Fahrenheit. That's generally seen 24 to 48 hours after post-injection and resolves 24 hours later. And so what we're asking people is if that happens, to stay home for that period, resolve it, and that particular situation, 24 to 48 hours post-vaccination would not necessarily call for COVID-19 testing. In a situation like that, that is somewhat of a normal process. And so that in the absence of any other COVID-19 symptoms, such as coughing and things that probably everybody's familiar with now, we're not asking for people to present for testing, for PCR testing at Wellness 360. Let's go to the next slide in terms of the general logistics. So probably the number one question that people are asking themselves right now is, when can I get my vaccine? I totally appreciate that and understand that. At the conclusion of our town hall, we'll start working with our COVID-19 team. We have more than 1,000 people that work directly with COVID positive patients every single day, part of their work at UT Health. We will start scheduling them using a web-based tool. They'll receive an email with essentially a website. They can then log onto that website. Literally takes 5 seconds to pick their date and time for setting their COVID vaccine appointment. This is all done in our EPIC, our electronic medical record, EPIC. It allows them to schedule that at the same time that we schedule their first dose. Their second dose, 21 days later, will be automatically scheduled. So if you pick your appointment for Wednesday at 8 a.m., 21 days later, your second dose will automatically be scheduled. We want to try to stick with that 21-day interval that Dr. Bowling and Dr. Patterson mentioned as much as we possibly can, because we do want to follow the EUA at least as much as we can. There is no direct cost to anyone. This is being provided to you by the CDC. So there's no direct cost to you. It's something that we all feel is incredibly important. So there's no exchange, no copays or anything like that. Once we can complete with the Tier 1 grouping, we're going to try to move to the Tier 2 just as rapidly as we possibly can. It may take 1 or 2 more shipments of vaccine to do that, but you'll start seeing, as Dr. Bowling and Dr. Patterson mentioned, you'll start seeing several other vaccine candidates over the next few weeks that are available, which will help that supply chain nationwide. So then the other question that people are going to ask is, where can we go to receive this? So when you receive your appointment email, it'll have a way for you to register that. It'll also have a little map in there that shows where you go. So this is an overhead map of the main campus, the long campus of UT Health. And this is Floyd Curl's on the right. Louis Pasteur is at the bottom, going left and right there. And circled right there in the center of the screen is the nursing school building. The nursing school building is adjacent to our dental school building. It's on the main campus. And within that building is a very large auditorium called the Hurd Auditorium. And we have the capability within the Hurd Auditorium to socially distance everybody and still do 24 vaccination stations at a time. So that's using our large facilities that we're very blessed to have at UT Health, we can vaccinate about 1,000 people per day using those facilities there. There's signage that will show providers how to go from University Hospital and a walking path to get to the nursing school building. There's also ample parking directly adjacent to the nursing building. It's kind of right there in that image where it says Parking Services Office. There is ample parking right in there for anyone coming from another outline clinic to be able to park there. The good news with this particular vaccine, because of the advent of Epic and MyChart, we will have a record. You'll have a record in your MyChart of the exact vaccine that you received, the manufacturer, the lot number, the date that it was received, even the arm that it was injected into will be in your MyChart in perpetuity. You'll be able to access that anywhere, and you'll be able to show your loved ones that you did indeed receive your vaccine. So let me turn it over to Dr. Sickora to talk about testing.
Thank you, Dr. Charlton. I want to thank my colleagues for inviting me to participate in this town hall meeting. Now that we've entered the next phase of the pandemic, the hotline is increasing its hours of operation. The phone will be answered from 8 a.m. to 10 p.m. daily and on weekends. Wellness 360 at the School of Nursing will continue testing symptomatic patients at 8 a.m. daily, and we've added Saturday to our testing schedule. If you are interested in asymptomatic testing, you can find information on our COVID-19 site, which we'll show you in a few minutes. The hotline will be answered through the holidays on Christmas Eve, Christmas Day, New Year's Eve, and New Year's Day. We will have special hours on those holidays. For more information, please access the university's COVID-19 website, where you will find all of our hours of operation and our testing protocols.
Thank you, Dr. Sickora. We've gathered a few questions that have become frequently asked questions within the UT Health San Antonio community. So the first question is, after I'm vaccinated, do I still need to wear my mask and practice social distancing, and will I be fully immune? Dr. Patterson?
That's obviously a really good question and an important one, and it's an important one to understand. So you saw from the data I presented that you begin to develop immunity really early, 10 to 12 days after the first dose, but you're not fully immune, right? And then the second dose is required to get immunity that is really incredible at 95%. But realize that 5% are still potentially at risk for infection. So you still need to wear your mask, practice social distancing, practice good hand hygiene. Those are really going to be critical until we receive enough immunity in the community as a whole to develop what we call herd immunity, right? That is enough immunity that really gets this virus under control. So continue to remember to watch your distance, wear your mask, and wash your hands.
So the next question is, if I already had COVID-19, do I need to get the vaccine? Dr. Bowling.
That's a great question. And at this time, we are recommending that people that have had COVID-19 infection still receive the vaccine. While reinfections with COVID-19 have been shown so far to be really rare, they still can occur. We don't know how long natural immunity or immunity you get after an infection lasts. So at this point, we are still recommending the vaccine. Importantly, ACIP, the group we talked about before, that's part of the CDC that helps with vaccine recommendations, does not recommend getting an antibody test prior to receiving the vaccine. We know that there are a large number of people that may have had asymptomatic infection that might get vaccinated. So we are including people that have had prior COVID-19 infection in the distribution plan, and we are recommending vaccine even if you've had COVID-19 infection.
Thank you. Who or what are credible resources to learn more about the vaccine? Dr. Patterson?
Thank you for that frequently asked question. So there are a number of credible sources to learn more about the vaccine. Locally, I'll turn you to our own COVID-19 website, but I'll also refer you to a podcast series conducted by local experts and hosted by Dr. Jan Patterson that you can receive any place you get your podcast. That would be from Spotify, iHeartRadio, Apple, but also from the CME utusca.edu website as well. So those are local resources that have kind of our own slant to it. Obviously, the CDC is an important research source as well.
Thank you, Dr. Patterson. And our next question is, will UT Health San Antonio students receive the vaccine? And this question is for Dr. Bowling.
So students were included as were all UT Health San Antonio personnel in the tiering system for the vaccine. So students will be receiving the vaccine. Again, our drivers for how we prioritize vaccine were risk of exposure and vulnerability. For risk of exposure, we also looked at mitigating factors. For instance, if you were able to prevent somebody from seeing COVID positive patients, that's an important and effective mitigating factor. But students are definitely included to receive the vaccine.
Thank you. And our next question is, where should my family get the vaccine? Dr. Patterson, would you take that?
Yes, thanks. So that's a really important question because we all want to get our families vaccinated as well. One of our goals here at UT Health San Antonio is to get our patients in our practice vaccinated. So I think that's going to be a tremendous opportunity. Our system is going to be set up to receive vaccine. And so we hope that our patients in the practice will be able to get vaccinated through that source. It's important, I think, to recognize, though, that general vaccination, because of the supply of these vaccines, is probably not going to happen until spring. And so I would also encourage you, for your family members or patients too, to consider participating even now in a vaccine trial. Some of the trials will have more vaccine than placebo, but even if you get placebo, when the vaccine becomes approved, then you'll be able to receive the vaccine, and frankly, will be first in line to get the vaccine after that approval happens. So as Dr. Bowling mentioned, we're part of the CoVPN, the COVID Vaccine Prevention Network, and we'll begin additional trials here very soon, and those will be available on our website as well.
Thank you. And our next question is, am I required to get it through UT Health San Antonio, or can I get it later when it becomes widely distributed? And will this be mandatory? Dr. Charlton, would you assist with that?
Thank you for that question, Michelle. That's a really good question. That's one that we do receive relatively often. As I mentioned, it is not required for anyone at UT Health or mandated for them to receive the vaccine. I think everyone on the call feels strongly that that it would be indicated, that it is something that would help us fight the pandemic. But there's no employment ramifications if a person declines it. The second kind of analogous part of that question is, what if I decide to change my mind? You know, let's say 2 to 3 weeks later, I look at the data, have more time over the holidays to look at the data, and I feel much more comfortable with it. It's also not an enduring decision. If a person decides, later in December or perhaps January that they feel like it is a decision they'd like to make, we would be happy to vaccinate that person at a later date. It's certainly something that we want to be flexible about and want to be as nimble as we can in order to provide that protection to our workforce.
Thank you. And our final question is, should I receive the vaccine if I have an immune problem or if I'm pregnant? Dr. Patterson?
Yes, so that's also a frequent and important question as well. The answer is not completely known, right? I think first and foremost would be if you have an immune problem or if you're pregnant or think you might get pregnant, would be to discuss the vaccine with your primary care physician, right? That's really important. That said, I do think the EUA that's likely to be approved by the FDA for the Pfizer vaccine will include the recommendations for persons with immunosuppression to receive the vaccine. That's going a little bit out on a limb because these are high-risk persons, but recognize they haven't specifically been included in the trial. So that would be patients receiving solid organ transplant or bone marrow transplant, or cancer patients and other patients receiving immunosuppressive drugs, just because they're at high risk. There is no signal that they would have a problem with the vaccine, and recognize there is no live virus or even attenuated virus. You don't get the COVID injected with the vaccine. And similar recommendations for pregnancy. Those recommendations are rapidly evolving. and we'll post those additional recommendations as we learn them. Locally, we are planning to participate in trials that would, registries that would follow the mom and the baby, the child, to make sure outcomes are safe and the vaccine is effective. Thank you.
Thank you, Dr. Patterson, and thank you all for sharing your knowledge, expertise, and guidance. For our closing remarks, President Henrich would like to share a few words.
Good. Thank you, Michelle, and thanks to my colleagues who've spoken today. More broadly, thanks to all the colleagues of ours who've worked so hard on this task force. The people you've heard from is a small sample of the expertise that we've garnered to study all aspects of this vaccine development. I want to assure everybody also that as the new vaccines become available, I've charged the task force with looking at the safety and efficacy profiles of each of the new vaccines that come to market. So if you're further along in the queue and don't get the vaccines currently available or will be available in this next few weeks, I want you to be assured that the vaccine task force will stay on duty and will look in turn at each one of the vaccines as they become available. And maybe the last thing to say is if you get vaccinated, if you don't get vaccinated, it's not the time to let down our guard at all. We have to continue to mask. We have to continue to avoid indoor group settings, have to curtail travel, and use good hygiene and social distancing. That's going to be part of our lives. We need to stop making it so easy for the virus to spread, so easy for the virus to continue to cripple the economies of our country, the economies of the world. And this step with this vaccine is a first intentional step to actually fight back with something aggressive to defeat it. We need to relegate this virus to the annals of medical history. And this is our first intentional step based on the incredible momentum that science has given us to take that step. I can say that if I'm offered the vaccine, I'm going to take it. That's my recommendation to my wife and to my adult children. The pros and cons of doing this aren't close to me. The benefit of the vaccine far outweighs the risk of taking the vaccine. So think about these details, read carefully about what has been presented today, go to the resource sites that have been offered to you and make your own decision. But this is a chance for our UT Health family to be able to remain very healthy and robust during the challenging months that we face ahead of us. If I could have the last slide, Michelle, I'd like to remind everybody of a couple of things. As Dr. Sickora mentioned in her presentation, the UT Health School of Nursing has done fantastic work in getting us ready for all the questions that we anticipate coming in, and also to keep our testing sequence alive and well. The key number to remember is 210-450-8000. That will be manned or staffed between Monday and Friday from 8 a.m. to 10 p.m. and on weekends too. The COVID-19 website is there and you can get more information there. The testing information can be also obtained from these websites. And I hope you'll avail yourself of these numbers and this information. So my last thing to say, the very last thing to say is please stay safe and be well. This is an exciting step forward for our entire UT Health organization. And I am delighted that we are taking it. And I am grateful to the Vaccine Task Force, to all the folks who've participated and contributed so much to get us to this momentous step. And if I don't get a chance to see everybody before the holiday break, on behalf of everyone at UT Health, best wishes for a peaceful and most importantly, safe and healthy holiday season. Thank you for tuning in.